A very good morning. We're glad you're still with us on Morning at NTV. That's the hashtag on Twitter. And my handle is at Chris Higenyi. We now go into our Take Note segment where we are speaking matters health. Now, tomorrow, a group of more than 200 doctors with specialization in different fields across Uganda are set to get technical updates on diagnostic laboratory, including abnormal hemoglobin studies, insight in HLA testing, among others, and of course to help us understand exactly what is going to roll out, because these are medical aspects and the terms sometimes they can well alter an average man's thinking like mine. We have Joshi Avidot, the CEO of International Business, joining us. Many thanks. How are you doing this morning?
Chris. I'm good, thank you.
What is going to happen?
Oh, it's interesting stuff. We are conducting a CME, which we call it as a continued medical education, where we would have a group of specialist doctors invited for the technical updates on the medical diagnostics field. If we just roll back, I would like to give a quick brief about where we're coming from. We are a chain of diagnostic laboratories.
That's right.
Been in this field for over last 40 years, having presence in about 7 countries. And we entered Africa about 7 years back with a motive that we wanted to bring the specialized testing platforms in Africa.
Yes.
So we started off in 2012 in Kenya, and then subsequently we added our laboratories across 6 countries in Africa. And we thought this is the time to enter Uganda. So this is our first launching platform in the country.
Okay, talking about health diagnostics and technical updates, ideally in a layman's language, that would be refresher courses in how most of these diagnostics are rolled out, or what is the latest technology in what is happening. Is that something near that?
Well, that's true, but it's more for the doctors.
For the doctors, yeah.
So just to give a small perspective, in the diagnostics field, when we fall sick, we go to see the doctor, and the doctors typically look at our condition and they may decide to get particular tests done for the better diagnosis. And once the diagnosis is done, then of course you go for the treatment. So typically we have the 2 different segments. One is illness, where we do the diagnostics of the patients in terms of the blood tests, urine tests, and there are 4,000 different varieties of tests which can be done for the accurate diagnosis of the patients. And then we have the different segment, which is we call as wellness segment. So wellness is something more like a proactive. Before even you fall sick, you might as well want to get certain tests done to check how well your body is doing.
All right, that's pretty interesting. So who you're focusing, you said, on doctors. What is the specific area, for example, who is eligible? All doctors?
Yes, pretty much.
Within Uganda?
Within Uganda, that's correct. So we work very closely with all the specialty fields, including gynecologists, oncologists, hematologists, pediatricians, orthopedics, rheumatologists, and even the general medical practitioners, including internal medicine doctors. Because we believe that coming in from the diagnostics field, it's our endeavor and duty to keep in touch with the medical practitioners and the doctors and keep talking to them about the new technologies which are advanced in the diagnostics field.
Okay. Now, talking about new technologies in healthcare, there is a tendency for Uganda to grapple with the cost of some of these technologies when it comes to acquiring them, so much so that many Ugandans go out of the country in order to be able to access and get these treatments. What is the plan like? Do we see in the long term or even in the midterm a possibility that some of these technologies will be made available?
That's correct. In fact, that is exactly what our focus is. We have invested heavily in all of these African countries, and now including Uganda. We have just set up our first facility in Kampala. And the plan is to bring those technologies at the doorstep of the doctors and the patients in the country, so that they don't have to leave the country for the diagnostics at least. For the treatment, of course, the doctors will have choices to do the surgeries or the further treatments here. But certainly for the diagnostics, we want to be the one-stop solution for all types of patients, whether it is cancer or whether it is diabetes or whether it is oncology or whether it is the genetics. So we definitely want to bring the diagnostics at the country level so that patients don't have to leave the country for at least the testing piece.
Okay, I would love to ask you a very personal question. Joshi Avedut.
That's right.
Which country from?
I'm from India.
From India.
That's correct.
All right. Now, the reason is simple. I didn't want to confuse India and Pakistan. It's possible you could confuse that. Now, India makes up the bulk of what we consider in the country to be medical tourism. It's pretty related to the question I've just asked, the fact that there's a lot of medical tourism that is happening between these two countries, and on the receiving end is India, and Ugandans are doing a lot of paying and stuff like that. Before you look at investment in technology, have you considered investment in human capital and human resources to be able to ensure that the people you'll be bringing these technologies for sufficiently have the knowledge to be able to use them in the long run?
Yes, that's a very interesting question, and that's exactly what we keep doing as a part of the diagnostics infrastructure. What we develop, the human capital and the skill sets are very, very important.
That's right.
Because in the diagnostics field, as much as your equipments and the automation is important, the building skill sets is equally important. So across Africa, we have now about 300 field force, which include the scientific teams, non-scientific teams, and all of these skill sets we have developed locally. So we have a very robust training program. In fact, we have something called as LMS, which is learning module sessions, and we use LMS for training skill sets, and that's exactly what is going to happen. Okay.
All right, so just looking at improving the health sector here in Uganda, that of course technologies are one of the things that will help put a few things together. What do you make of, have you had interaction with government, Ministry of Health, on what particular areas, if after you've done with the doctors, what areas of intervention you might be able to look into? Have you contacted or consulted with Ministry of Health on that?
Yes, that's right.
What are those areas?
So we have been talking to the multiple the sectors within the industry, including the doctors in the public sector, the ministry, the doctors in the private sector, and also going and talking to some of the CEOs of different hospitals, just to understand what is exactly needed in this country. So there are few things which emerged quite well, as you pointed out rightly, is better accessibility to the diagnostics facilities. So this, we believe, is number one priority for us. Number two, bringing technology. Why technology? Because that will actually bring down the costs substantially, and it becomes affordable. And number three, the scalability. So when we say scalability, that leads to the new advancements, like how do we set up multiple collection points so that patients don't have to come to our main lab? How do we build the infrastructure where we have the home visit phlebotomists or technicians who can go and visit the homes of the patients, so that the patients don't have to again visit the laboratories? So these are certain advancements which we are doing, and I believe this is exactly what is coming out as a message when we talk to multiple section of people in the country.
All right, and finally, the connotation of coin, the cost of some of these technologies is very important. Ugandans will be looking out to affordability. What do you make of that?
So most of our tests are going to be definitely affordable, while we don't compromise on the quality. That's primarily because we are bringing technology on board, and the way we are working is how do we improvise the overall quality of the patients and the diagnostics by keeping the costs low.
Okay. All right, I think that will do it for now. Any last remarks regarding to international business and any inroads?
So we are very happy to be in Uganda. Our first lab is in Kampala itself, and going
Where is
forward,
it located?
It's on the Mugamba Road.
Buganda Road.
Buganda Road, sorry.
Okay.
It's on the Buganda Road, just next to the Case Hospital.
All right.
And what I urge everyone is to focus on the quality in the diagnostics, and this is exactly what we want to bring in the country at this point of time. Thank you.
All right, many thanks, Joshi Avedut, CEO of International Business, and for giving us that perspective on health diagnostics and the need to ensure that you access some of these latest technologies in healthcare to be able to ensure a good life. Of course, like I said and emphasized, affordability is key. You'll be able to understand exactly where you fall in terms of accessing some of these. Now we are entering the final bend of Morning at NTV. We, of course, are emboldened by the fact that you've been with us all this far, right from 6:30.